If you take 10 guys, 3 out of them are 2-minute men. They have premature ejaculation. Today, I'm going to show you 5 ways to overcome premature ejaculation. Now, if this is the first time you're seeing my videos, my name is Dr. Shades. Welcome to the Shades family. I want you to be part of the family. Kindly subscribe. Let's work together. 5 ways to overcome premature ejaculation. Before we go into it, I want you to understand what premature ejaculation is, why you have premature ejaculation, so that if you understand why you have premature ejaculation, you can understand how to overcome it. Now, when you talk about premature ejaculation, it's basically when you are not able to last as long as you or your partner would want you to last. So let's say you want to last for like 5 minutes, but the moment you enter, within 1 minute, you're PPO. That is premature ejaculation. What are the causes of premature ejaculation? The first cause is penile hypersensitivity. Some of your body is sweetie too much. The moment you see a JY and you enter the thing, then the impulse starts running to the brain. Within 1 minute, you PPO. That is a problem. You PPO because your body is sweetie too much, not because you have a disease or you have a problem. The second reason why you have premature ejaculation is because you have what we call performance anxiety. Now, when we talk about performance anxiety, let me explain. Before a JY will come to your room, the moment she says, "I'm on my way," then you start thinking, how am I going to please this girl? Is my penis big enough? Am I going to satisfy this lady? Which position are we going to do? Monkey in the shadow, teacher standing, take it, doggy in the air. You'll be thinking, how are you going to satisfy this babe? Because of that, when finally the thing opens for you and you enter, because you are anxious, you PPO within 1 minute. And that is a problem. It is called performance anxiety. Some of you are also scared of your molar size. You are scared that your tibia is not long or big enough. So you are scared. All these things affect you because when you are scared and you are anxious, a hormone called adrenaline is produced. And you see, there is a hormone that makes you last longer. It's called serotonin. When adrenaline is produced, it interferes with that hormone. So it prevents you from lasting as long as you should have lasted. And that is a problem. The third reason why you are a 2-minute man is because of stress. Now, stress is not good for men. Some of you wake up at 3 a.m., you go to work, by the time you close, you are tired, you join traffic, you come house, you are tired. But you also have a woman in the house that you have to satisfy. You see, you're already stressed. And when you are stressed, hormones are produced. One of the hormones is the adrenaline that I mentioned. And it's going to interfere how you perform. Okay, so all these things contribute. And now you may enter and then you've come within 1 minute. That is a problem. The fourth reason why you don't last long in bed is because you will not stop smoking and taking cocaine. You see, smoking affects your general system. It affects your lungs, your liver, your kidneys, your performance, your blood vessels. It damages your nerves. And when you take recreational drugs like cocaine, they also activate the adrenaline that I was talking about. At the end of the day, it's going to affect how long you last in bed. Now, the fifth reason and the last reason why you don't last long in bed is because of alcohol. Understand, alcohol can delay ejaculation if taken in small amounts. But if you become addicted to it, every time you are taking alcohol, it's going to do quite the opposite. So you have to stay away from alcohol. Now that you've understood why you don't last long in bed, let me teach you how you can last long in bed. I'm going to show you 5 solid techniques to last long in bed. 5. Stay with me. The first technique is called the start-stop technique. It's like traffic lights. Now, for this technique, what happens is that you stimulate yourself, or probably with your partner, you guys stimulate yourself to the point where you're about to ejaculate. You see, there is a point called point of no return. At that point, your muscle, you don't control your muscles anymore. Your muscles control themselves. Just when you're about to reach that point, you stop and then you withdraw. You allow the stimulation to calm itself down. Usually within 10 to 30 seconds, it will go down. Then you start again. So you start, you stop. See, when you master this technique, and you can last as long as you want to last, because whenever you are about to PPO, you stop, you allow it to go back, then you penetrate again. That is a start-stop technique. The second technique is called the squeeze the tip technique. You see, with this technique, it's like the start-stop technique. But with this technique, you have to apply a small pressure to the tip of the penis because that's the most sensitive part. So when you're about to ejaculate, you withdraw, pinch the tip for about 10 seconds. Then you allow the feelings to go down. Then you relax about 30 seconds, then you penetrate again. That is the squeeze technique. The third technique and the most important technique to me is what we call the Keel exercise. You see, Ejaculation is controlled by muscles. If you're able to control these muscles, trust me, you can last for 10 hours, 24 hours. You can last for as long as you want to last. And to control muscles, you have to master the Kegel exercise. When I talk about the Kegel exercise, it's simple. See, when you're about to urinate, it's the same muscle that controls urination, okay? So when you're about to pee, you hold the pee when the pee is at the peak. You see, sometimes when you're peeing, when it's difficult to hold it, that's the point where you hold it, at the middle somewhere, where it's difficult to hold it. You hold it for about 10 seconds, 20 seconds, and then you release it, and then you hold it again, and then you release it. When you do this technique for 2 to 3 months, you realize that now you can control your pee. And if you can control your pee, it means you can control your ejaculation. So with this one, you don't have to withdraw anything. If you are hitting and then you're about to pee, then you hold it inside, allow it to go back, then you continue. That is the Kegel exercise, and it's a brilliant exercise. The fourth way to overcome premature ejaculation is to use the topical anesthetic agents like dragon spray. I mean, I know this one, you know it, but then you can use that one. Now, I mentioned that one of the reasons why you have premature ejaculation is because your penis, they sweat you too much. Your body, they sweat you. You have penile hypersensitivity. Now, this topical anesthetic agent is going to overcome that hypersensitivity. When you apply dragon spray to the tip of your penis, it makes the place numb. So you can have sex as long as you want without ejaculating. So far as the effect of the dragon spray is there, you are not going to feel anything. So you can have sex for as long as you want. You get me? So now, how do you apply it? You hold the penis, the tip of the penis, you apply 2 to 3 drops, you allow it to dry. After 5-10 minutes, you go and wash it off so that you don't transfer the effect to your partner. And then you come and hit. The last technique to overcome premature ejaculation is to speak to a doctor. See, if you do all these things and you are still suffering from premature ejaculation, you have to speak to a doctor so that we do some investigation to find out what is wrong. Okay.